Prevention and management of a blocked feeding tube. Common causes of tube blockages. A feeding tube may become blocked for a variety of reasons. The most common reasons for a tube blockage include inadequate water flushes, inappropriate substances being administered by the tube, incorrect administration of medications, a kinked or twisted tube or a closed tube clamp, or feeding tube deterioration. How to prevent a tube blockage. It is important to ensure regular water flushes as prescribed by your dietitian, with fine-bore tubes requiring more frequent water flushes due to their increased risk of blockage. Only enteral formula prescribed by a dietitian should be administered via the feeding tube. It is important not to administer any vitamized or pureed foods through the feeding tube. Finally, ensure all medications are compatible for administration through a feeding tube and completely dissolved in warm water. Medication should be administered one at a time with water flushes before and after the administration of each medication. Unclogging a blocked feeding tube. You may have heard that carbonated beverages can be used to unblock a feeding tube. However, there is no evidence to suggest that this is effective. In fact, the high sugar content of these beverages may actually cause degradation of the feeding tube. Warm water is actually the best method for unblocking a feeding tube. Step 1. Check that there are no kinks along the length of the tube and that the clamp is open. Step 2. Half fill a 60 ml syringe with warm water. Step 3. Connect the syringe to the feeding tube. Step 4. Gently push and pull the plunger to help loosen the blockage. Step 5. Gently knead the tube with your fingertips to help dislodge a physical blockage. Step 6. If this push or pull method does not clear the blockage straight away, clamp the tube with the water in it for approximately 15 minutes. If this technique does not work and the blockage persists, please consult your dietitian. If the tube is still unable to be unblocked, it may be necessary to discuss tube replacement with your medical team. Thank you.